Next in line to offer expert opinion on a newly founded Independent Health Commission, we have Professor Edwin Barasa, the co-chairman of AHAIC Commission.
Commission on the state of UHC in Africa was essentially set up to take stock on the progress that African countries have made with regard to universal health coverage, to identify some of the challenges and opportunities that the continent is facing, and also make recommendations on what African governments can do to accelerate progress towards universal health. But African countries have made some progress. African countries have made a commitment to extend access to services and have made some progress, but gaps still exist, as you rightly pointed out. And the reason that we have these gaps is because of a myriad of challenges. And these challenges can essentially be looked at as challenges emanating from the broader context of African countries on the continent and health system, health sector specific issues.
You talked about the investment landscape, but can you tell me exactly what is it like to invest in the African healthcare system? Why don't we see a lot of investments going into this sector? And why don't we see a lot of private sector players going into this space?
The share of government spending on health has to be at least 5% of country GDPs. But what we see is that on average, African countries spend only about half of that, so about 2% of that. And that's an average. So you have countries that spend way below 1% of their GDP. So clearly there is very little investment in the health sector. COVID is a very good example. It's demonstrated to us that investing in health, or rather what happens with the health of the people in a country, affects their economy. We know that the COVID pandemic has, for instance, resulted in a contraction of between 2 to 5% of African economies. So that, if there's anything that we should learn from that, is that investing in health protects our economies, but it also provides the human capital that's required to increase productivity. Other than constrained economies, one of the reasons is that, as I mentioned earlier, it seems that African countries do not prioritize the health sector. And one of the things that one of the factors that explains this is the fact that people, governments still view the health sector as a cost center rather than an investment center.